have different beliefs about mental health conditions which are not true. These beliefs, when not corrected, affect our mental health because they cloud our judgment and prevent us from engaging in activities that protect and maintain our mental health. One of these beliefs is people with strong support network systems will not have mental health conditions and do not need therapy. If so be it, then health professionals, bankers, lawyers wouldn't have mental health conditions in the first place to even end up seeking for therapy. But all these people have mentioned do or are at risk of having mental health conditions and also seek for therapy. The next belief is having a mental health condition is a sign of weakness. No, it isn't at all. We all are human beings. There are days you might be able to control your feelings, thoughts, behavior, or for a particular person, the person always has control of all these things. There will be a particular day that you wouldn't be able to control them. And you being in that situation doesn't mean you are weak. It only tells how human you are, because as a human being, there's no way you'll be able to control certain situations all the time. Some people also believe that nothing can be done to prevent or to protect people from developing mental health conditions. Yes, some mental health conditions have biological factors, which means that the person has a higher risk of developing it. But there's something that can be done. Let's not forget that developing mental health condition isn't only as a result of one factor. There are lots of factors that come into place. So you having a family history of a particular mental health condition doesn't mean that nothing can be done. You engaging yourself in activities that protect and maintain your mental health can actually reduce its intensity, even though it can't protect you from developing it in the first place. Some people, poor mental health is not a big issue for teenagers because they believe that all characteristics exhibited by teenagers are as a result of their hormonal changes. Yes, their hormonal changes affect their behavior, but there are times it's not only as a result of the hormonal changes, but they are actually having mental health challenges. And to be able to distinguish between these changes that are as a result of hormonal changes and the ones that are as a result of mental health conditions, a mental health professional is needed to help you identify these changes, or to be able to differentiate between the characteristics that are as a result of the hormonal changes and the ones that are as a result of mental health challenges. To some people, taking care of your mental health is only needed when you have mental health conditions. In the first place, we sometimes forget that mental health conditions are made up of mental health challenges and mental health disorders, but we mostly focus on the disorders, forgetting or neglecting that of the challenges, thinking that the challenges are not mental health conditions. We actually have to take care of our mental health, because taking care of them, we are able to manage these mental health challenges and even prevent them from developing into disorders. For example, stress. When you are a type of person that do not take care of your mental health, you wouldn't be able to manage stress, and stress can lead to addiction. Addiction can lead to the development of psychosis or other mental health disorders that we think we need to develop them before we should take care of our mental health. Another belief is people with mental health conditions are less intelligent and do not contribute meaningful to their community. In the first place, what is our definition of intelligence? Drivers, engineers, doctors, lawyers that are performing their work duties are also contributing meaningfully to their community, also at risk at developing mental health conditions, and some of these people are already even having mental health conditions. It's also believed that everyone with a mental health condition is crazy, or shall I say the craziness means here that they are being psychotic or they are seen misbehaving around, but that's not the case. We all remember this song by this musician La Bianca talking about people and how she's not being noticed. So you realize there are times that people will be going through mental health challenges, but you wouldn't notice them. And you not noticing them doesn't mean that they are not going through any challenges. That's because it's not all mental health conditions that allow you to misbehave around, but with some of them you will be facing them and it wouldn't be noticed by others. It is also believed that mental health conditions are extremely rare. I believe people have this perception because we mostly focus on the disorders than the other challenges that we easily encounter in our everyday activities, such as stress, anxiety, we all forget that down ones also fall under mental health conditions, but rather focus on the disorders such as schizo, bipolar, and think that they are extremely rare. If they were to be extremely rare, researchers wouldn't show that most of these mental health conditions develop by age 14 and others also developing by age 24. Others also believe that everyone with a mental health condition is aggressive and violent. That's not the case. How many times do you even see people that are mentally challenged on the street chasing others? If you don't do anything to them, they wouldn't chase you in the first place. So that's not the case at all. That most or everyone with mental health conditions are aggressive and violent. They aren't. Actually, to some extent, we say they are actually the victims here, because we go worry them or disturb them, or you find children worrying them on the street side. Lastly, others also believe that mental health conditions target particular sex. That's not the case. It's only sad that we all are at risk of developing mental health conditions, no matter the sex. Either female, male, us are at risk of developing mental health conditions. Just that there are times that some mental health conditions will be mostly seen in males than females, or in females than males, because sometimes our genetic makeup influences the rate at which we develop some mental health conditions or our development of a mental health condition. Finally, let's not forget that mental health conditions are not as a result of only one particular factors, but are as a result of multiple factors, and everyone is at risk of developing mental health conditions. Thank you for watching. Subscribe, like, share, and comment. Enjoy the rest of the week as you keep your mental health in check. Bye.